Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Ahead of World Malaria Day, we bring you an extended episode of Malaria Minute, a podcast from the Johns Hopkins Malaria Research Institute. In this episode, guest host Thomas Locke takes us to Capitol Hill, where we meet malaria champions, scientists and leaders who are lobbying members of Congress to fund their interventions against malaria at a truly critical time. We hear from them about their work and what scientific messages they bring to D.C. to impart on policymakers in an effort to, quote, keep our foot on the gas pedal of malaria prevention and control. You can learn more about the Malaria Institute's work at the links in the show notes. Let's listen.
Hello and welcome to a special edition of the Johns Hopkins Malaria Minute, a podcast sharing impactful malaria science and the trailblazers leading the fight. Today, we're casting our net beyond scientific research to focus on the importance of malaria advocacy. That is, engaging members of Congress to encourage them to support global health efforts, including malaria. And so today, we're on the ground in Washington, D.C., joining over 120 champions from 45 states who have come together to share with their members of Congress why they care about malaria. We want to dig a little deeper into the mechanics of malaria funding to understand which programs the US supports and how they work to reduce cases and deaths. To do that, we'll speak to a former lead at PMI, the President's Malaria Initiative, and a representative from the Ugandan government. But back to Capitol Hill, these advocates, champions as they're known, have been brought together under the auspices of the United to Beat Malaria, a non-partisan advocacy campaign based in DC. Margaret Riley McDonnell is its executive director.
United to Beat Malaria Leadership Summit and Advocacy Day is always a bright light of the year, especially now, and we need our champions more than ever to advocate. So we always say their advocacy is important, but truly it has never been more important. Members of Congress need to hear from United to Beat Malaria champions and our partners that they care about these investments and these commitments to protect children and families around the world. We're really happy to have champions from 45 states across the country. That's our most significant span thus far. Many of these programs have endured strong bipartisan support across administrations, across Congresses, because people recognize that, for example, the U.S. President's Malaria Initiative is a smart, strategic, cost-effective, impactful program that saves lives.
The US government has been a strong supporter, not only of scientific research into malaria, but also key programs aimed at reducing the number of cases and deaths around the world. The flagship program is the President's Malaria Initiative, or PMI, which was founded in 2005. Dr. David Wharton was its global malaria coordinator until January this year. Here he is explaining the climate in which PMI came about.
The efforts to fight malaria were very fractured and not well coordinated. And I think both PMI and the Global Fund really consolidated the efforts. And so George W. Bush, he started PEPFAR, the Global Fund started under him as well as PMI. So really, global solidarity was remarkable and I think has had an incredible legacy over time. PMI started with 3 countries. And up until a few months ago, we were at 30 countries. So the ability to both expand the efforts and really help the partner countries bring down cases and deaths of malaria was remarkable and with incredible bipartisan support, because ultimately, I think both sides of the aisle realize the incredible results that we were achieving as a U.S. government through PMI and also through the Global Fund, because we were working together in countries along with the partner governments in order to bring down those cases and deaths.
The bread and butter of PMI is the procurement and distribution of key public health measures to control malaria, such as bed nets, test kits, seasonal malaria chemoprevention or SMC, and anti-malarials.
In those early years, really this was the early days of bed nets. And so just even when you think all the way back to, again, Admiral Ziemer was the first PMI coordinator, just the initiation and the scaling and the procurement and the dissemination and implementation of bed nets was an incredible success, as well as ACTs, the primary treatment that we're using in almost every country to fight malaria.
To emphasize, bed nets have a dual purpose. Not only are they a physical barrier between you and the mosquito, but they also contain insecticides that kill the mosquitoes upon contact. They reduce the spread of disease and vector populations.
When you look at the cases of malaria from really 2000 to almost 2016, you see year-on-year declines in morbidity, mortality, and case numbers. And that's in large part to the initiation and the dissemination of effective nets, effective treatment, and again, really introducing care, effective care, into places that had really ultimately been clinical deserts in terms of the country's ability to treat malaria effectively. I think it's also important to understand how fragile these winds are, because malaria is such that when you take your proverbial foot off the gas, when some of these things, you take these preventative efforts away or these access to treatment issues away, the rebound is incredibly fast.
Uganda is one of the countries that PMI has partnered with to improve access to malaria interventions. In fact, the country has just introduced the R21 malaria vaccine for over 1 million children under 2 years of age in 105 high and moderate transmission districts across the country. It's the largest rollout of the jab to date. Dr. Jimmy Apigo is part of the country's Ministry of Health and National Malaria Control Programme coordinator.
Uganda is in East Africa. We are right on the equator. And as far as malaria is concerned, you can imagine what that means. We don't have winter. Winter helps keep the mosquitoes down. So we have all year round transmission, but there are seasonal peaks, which coincides with when we have the most rains.
Through a combination of mosquito nets, insecticidal spraying, and drugs to prevent and treat malaria, Uganda has dramatically reduced its malaria incidence.
We have, in the past 10 years, really registered incredible success. Globally, malaria reduction over 1/3 drop in cases, although there is stagnation, and almost 50% drop in mortalities. In Uganda, we have reduced actually cases by over 60%. We still remain the third most contributor of malaria cases. Is because, unlike in other countries, it's not seasonal transmission. It's all year round transmission. The other countries we're being compared with are having transmission only 3-4 months. Also, they're having transmission not all over the country. They're having transmission in particular zones. According to the last WHO report, we are the 10th contributor of malaria death. That means where else we have falciparum malaria, we have effectively worked on people accessing care and preventing death. We know very well that if you treat malaria within 24 hours, the chance of transitioning to severe malaria is greatly impacted.
How much of Uganda's malaria response relies on external funding, perhaps from the United States? And how do you coordinate external funders to ensure that everyone is working towards the same goal?
So in terms of key inputs, especially health technologies like bed nets, test kits, insecticides, anti-malarials, we have been heavily reliant on development assistance, donors, grants, mainly the Global Fund, the U.S. President's Malaria Initiative, the Gates Foundation, National Institute of Health, philanthropy like GiveWell, AMF, Malaria Consortium. The delivery system, which is another very costly because it involves the supply chain, the human resource, the clinics, is completely relying on our national healthcare system and the primary healthcare system. Now, about making sure that this development assistance is well applied and avoiding overlaps and duplications, we have very clear strategic plan and operational plans. And we sit with the donors to zone properly where each person's effort is best placed and how they can also leverage on each other.
For example, whilst USAID funding in Uganda has supported the targeted distribution of bed nets to children and pregnant women in health facilities and schools, the Global Fund, an international consortium of funders, of which the US contributes no more than 1/3, has focused on nets for all. And while PMI has focused on treating malaria, the Gates Foundation has focused on prevention.
There's no duplication, there's no overlap, and it's smartly done in a collaborative way. So our role really is to support functionality of partnerships and collaboration so that we maintain and leverage the synergies.
By layering different interventions and coordinating between funders, partner countries can ensure an effective distribution of resources. And it's these programs which our 120 plus advocates are asking Congress to ensure continue to be funded. But closer to home, it's also important to emphasize funding for science and research. Some of the funding comes from the US government, but other funding comes from elsewhere, including philanthropic organizations. The Johns Hopkins Malaria Research Institute, which produces this podcast, has been continuously supported by Bloomberg Philanthropies since its creation in 2001. This funding has established a state-of-the-art research facility with the goal to develop innovative strategies to prevent and cure the deadly disease, in close partnership with researchers in African countries. JHMRI is one of several institutions focused on malaria research globally. Jamie Bain-Nishi is the CEO of ASTMH, the American Society of Tropical Medicine and Hygiene.
So ASTMH is the world's largest scientific society, bringing together a community of PhD scientists, clinicians, and public health professionals, really working to advance science in the fight against malaria, neglected tropical diseases, and other intersectional or interdisciplinary global health areas. The U.S. role in malaria research is longstanding. The U.S. government has been a critical investor in malaria research for decades and decades, and that research endures. Today, we have multiple U.S. agencies that play a really critical role in advancing health research. The U.S. National Institutes of Health support, especially through NIAID, the National Institute for Allergy and Infectious Disease, doing research to look at malaria resistance, monoclonal antibodies, which are looking especially useful for treatment of pregnant women and newborns. There's work being done, of course, at the U.S. Centers for Disease Control and Prevention on surveillance, but also development of testing and testing of the tests and testing of mosquito nets. And there's a lot of indoor residual spraying review, looking at how do we really keep up and make sure that the products that are being introduced around the world are effective. And of course, we think about partners like the President's Malaria Initiative, delivering commodities. They're delivering bed nets and drug treatments and now malaria vaccine. They're also doing operational and implementation research to see how is that work panning out when it hits the real world, when it hits the most affected communities.
The US commitment to malaria research and control is long-standing and bipartisan. The Assembly of the Champions aims to keep it that way, to move the needle against malaria and ensure the foot does not come off the gas. As the champions prepared to head to the Hill, former Congressman and chair of the House Committee on Foreign Affairs, Ed Royce, delivered a talk on the importance of US leadership in malaria control and research.
I chaired the Africa Subcommittee for 8 years and the full committee for 6. And so I know the challenges in Africa, in Latin America, in Southeast Asia, all over the globe. And malaria, we know the solutions. We know, thanks to your good work and your engagement, how to deploy and tackle this. These are not necessarily new approaches, but science has moved forward. Human lives are an issue here, especially when you have the science, you have the hospitals behind you, the alliances with other countries and other partners and NGOs and major philanthropists who are all lined up to do their part. But let's face it, we need the leverage of the United States in this equation. One of the things the United States has done is to work with people locally in order to bring them up to speed, give them the capabilities, teach them how to help solve these problems. Members of Congress, maybe are not aware of the NGOs in their district, of the hospitals in their district that are involved across Africa. They're often not knowledgeable about the religious institutions, the churches, synagogues, mosques, and so forth that work across the globe on behalf of public health. They're not aware maybe of some of the physicians who every year travel around this world in order to engage on these types of issues. This is a very small, commensurate contribution that the United States makes, along with other countries in the world, in order to tackle a problem that is not going to stay localized if we're not there to tackle it.
My thanks to Margaret Riley McDonnell, Dr. David Walton, Dr. Jimmy Opigo, Jamie Bainishi, and Ed Royce for featuring on today's podcast. You've been listening to a special extended edition of the Johns Hopkins Malaria Minute. I'm Thomas Locke.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.